Good afternoon, everyone. Thank you so much for joining us today. My name is Shelly Hayes, and I work here with the member engagement team, and we are so excited to be able to spend the next 30 or so minutes with you to talk through the benefits of our member engagement team. There's a number of us on the call today, and if you do have questions, feel free to shoot those over utilizing the dashboard in the top right-hand corner. If we do not get to questions today, if you send those in, we'll have your email address if you signed in with it, and we'll make sure to get back to you via email, but we'll do the best job we can to capture those questions and get those answered for you very soon. So let's go ahead and jump right in. And for those of you who are new to us or new to the Federation model, just a little bit of community health charities, you can see our vision and mission here. And we are really here to stand beside you and partner with your organization to really match up those donors in the workplace with your charity. And really for the perspective of, we're doing this work for you so that you can focus on, the mission, the very critical mission that your organization works on a daily basis. And so, our approach as we move, amongst both the private and public sector campaigns, for those of you who are familiar with this, let me just repeat for those who are not. On the private side, that's going into those companies that do their private workplace giving campaign, those companies that do workplace or employee engagement. But then on the public side, that's the groups that are our federal employees, military, and postal. And so either way, our approach to both of those is really to build that culture of charitable giving. The goal, again, to improve the relationships and improve lives while offering donors a vast majority of the causes or the illnesses that they would like to support. And so really as we go into the workplace, both private and public, this is the approach that we take, that we really want to, be that connector point for your organization. Hopefully introduce your organization to new donors that you don't already have or don't already know. So just to give you a little bit of history and background, we are a health federation, obviously participating in both the public and private sector, really have been focusing on workplace giving, but now really getting excited about the opportunities in front of us when it comes to employee engagement. And so taking it beyond, and over the next several months, you'll begin to hear the vision of what our team is coming together to really move that agenda forward on your behalf. So you can see over the last, 5 or so years, the total dollars that have been raised on your behalf. And that's, again, our continued desire to increase that dollar that gets to you. And so as we think about the process that Community Health Charities has been going through over the last several months of consolidating, both on the field staff and application side, one of the big benefits for us to do that is to put more money out to our members or increase your ROI. So by our organization moving in this direction, the goal is to reduce our overhead and therefore be able to push those donor dollars out to you, obviously faster, but get the dollar out to you in a more streamlined and increased way. So for those of you who are national organizations that have had chapters across the country, you know that the way that we worked before with our affiliates across the country is we each had different withholding fees. And so it would be different in one part of the country versus another. So one of the benefits that putting this member engagement team together is that we will have one standard withhold fee, and that will be very clearly presented to you, and that can reduce a number of the questions that often come forth with trying to understand the way that our processes have worked. Also really excited about retaining staff by skill set. And so all of you on the phone have likely met virtually your manager that has been assigned to your organization. If not you, somebody on your team has connected with them to do the applications this past fall. And so we really looked at a couple of things in retaining those staff, those who have had really great success rates in collecting and submitting the applications. But also very important to us is those who have and know how to build those relationships with those campaign managers, and really being able to take a look at what your organization is currently doing and helping them to facilitate what that might look like to increase the number of campaigns that you participate in, both private or public sector side. So we're really excited about the team that we've put together, and I trust you've been able to connect with your application manager now working on member engagement as we move forward. So the goal also and benefit that we want to make sure that you're experiencing and feeling is having a one-stop application submission, whether it is for state campaigns, the membership application, the combined federal campaign. Our goal is really to eliminate duplicate requests. I know some of you have talked to before with all of your chapters and everything that has been in play. You might have to have sent a 990 a half a dozen times to our staff. So the goal now is that in the fall, we collect all of that information so that you're not having to retrace those steps as you move into the spring and into those state and local campaigns. We're making those first strides this year, but our goal is we, refine our processes and gather the information together, is that we will in the fall be able to say, oh, you participated in these, additional 4 or 5 states. Here's what we collect for those. Now, oftentimes, many of you know who've done this for a long time. Those states don't necessarily put their applications out in the fall to us. But at least we know, let's say it's the Wisconsin state campaign, and we know that they ask for the list of your staff who make $20,000 or more. Well, we can go ahead and start collecting those things. So collect those things in the fall. So we know, oh, you participating in that. We want to go ahead and start collecting those pieces, really to make the process in this late winter and early spring as easy as possible. So we'll hopefully just asking you for the actual application. So lots of pieces and strides that we've made, but lots more to improve upon as we move into the next phase of the process. And so we're really definitely excited about that. From a communication standpoint, our goal is to communicate with you about the very important things. We don't want to fill your inbox with things that you don't necessarily need or do not necessarily improve your experience or your ROI in the campaigns. But we do want to communicate with you on an ongoing basis and really stream that for you. And so we're working with other departments in the organization to get all of the information compiled in a database that is, easy for, each of you to be able to hear from us directly. I did have a note come in, and it said, could the person typing or shuffling papers mute yourself? And so I apologize for that. I actually don't hear it, but probably because I'm talking. So if possible, whoever's shuffling papers, if you could mute yourself, that would be terrific. Then really providing that long-term support as we move in. We want to hear those recommendations for you. This is a very new team that we've put together in just a short amount of time. And so we know we have a lot of opportunity to really move forward and serving you in a better way. And so we don't know those things. We see things from our perspective. So we really appreciate you taking time to send your feedback to us. You can always send it to your manager, or you can definitely send it to memberconnection@healthcharities.org. But we want to continue to refine this process and really make it much easier and less time consuming for you as an end user in that process. So talking a little bit about our communications, we do have our member connection, which started this past month, and it'll drop again next week. But this will happen on the second Thursday every month, which contains lots of good information for you. And that one of the differences between the member connection and the member connection update is who the distribution list is. So if you have people in your organization that need to hear that high-level overview type communications, definitely give their information to us, and we can put them on the member connection distribution list. If you are our primary application contact, you are receiving a member connection update each Tuesday. And we really encourage you to look at that, because that is the format that we are using to communicate those additional state and local campaigns with you. That process will continue to be robust and refined to include the campaigns that have closed, those campaigns that you actually are not required to put an application in, but we would make sure that you meet those requirements so that we can certify and therefore put you in those campaigns. So we'll continue to build that out, but I just wanted to draw your attention to these two communications, and you can definitely let us know by sending an email to memberconnection@healthcharities to let us know if you'd like to be included or if you would like to add somebody else to either one of them. So we briefly were just talking about those additional campaigns, and if you look at your member connection update each week, you will also be directed to our public sector resources site. And this is where all of that information is stored. So as of today, there are 3 open campaigns that you would want to go check out to determine if your organization is eligible to participate in them. So this is additional campaigns that are like state campaigns. Some of them will be city. Again, if there are campaigns like municipal or university that don't require an application, rest assured that we are putting you in those campaigns. We've collected that information from the affiliates that you worked with previously to make sure that we have the list to confirm that you participated last year. And so we'll make sure, again, that we can certify you, and we'll continue to put you in those campaigns. But make sure you look at this on a weekly basis, because that's really an opportunity for you to maximize your membership. So again, on the public side, we really encourage you, and we're happy to work with you if you have questions on determining your eligibility for those, letting us know your interest, and we can help manage you through that whole process. And so I want to give a big shout out to those of you who have submitted your marketing materials to us this year. This is an opportunity for us to collect your stories of caring, what a dollar buys, your logo, and we use those in various ways throughout the year, both internally and then externally with campaigns. So I just really appreciate each of you who took the time to do that. That makes our job a lot easier. So as we build out the different platforms, and what I shared with you at the beginning of the dialogue, that this will help us as we build out our causes and take a look at the way we approach the private sector If we don't have that information, it makes it more difficult for us to promote you and get you recognition in those campaigns. So continue to filter that to us as much as possible. Also, we touched base on it, but reading your member connection update weekly, just being really mindful of all of the deadlines and connecting with us on a weekly basis to determine, your eligibility. Many of you do a great job of social media during campaign season, whether it's CFC or some of those state campaigns. But we would just like to encourage you, those who are not doing that, to really think about, highlighting the partnership with the Federation as well as CFC and other ones who, other ways during that fall campaign season. If you have questions on that, your application manager or myself can definitely walk you through that process of how to take what you currently do and overlay CFC and other pieces, being mindful. There was a question that came in that said, where do we send your marketing materials? That would have been the second step in your online application if you were a local charity. If you're a national charity, we asked you for that during the application season. Those were due to us in February. If you missed the deadline, you can email those to your application manager and they will save those for you as we move on. And this is a part of the member engagement. So as we started the process, our team was really put together because we knew we had to gather the applications and get those out to the campaigns. But now as we are really wanting to strengthen our relationship with you, the team is now beyond that application manager. It comes into ways that we can engage with you to help, increase your stature in these campaigns, including this piece of it. So definitely get those over to us. Another great benefit of the consolidation is consolidated pledge and donor reports. So mainly for those groups who are national and have lots of chapters, the goal of getting your pledge and donor reports consolidated. You can see the breakdown of when those should come out to you, both for CFC, non-CFC, over the next several months. And if you do have questions in the past, you might have, talked to one person in the office, in your affiliate office. Now we have a great group of people who make up the finance team. And so clearly they're there to serve you as well. Go ahead and send over any questions on your reports to the finance team, and they'll be more than ready to work with you on those. So I'm sure, as we mentioned earlier, that you've talked to your member engagement team manager, but we just wanted to give you a look across the country at the team. So sometimes it goes a long way to be able to connect. And I have to mention, all of our team members do have video capability, so feel free to not only call with them, but definitely set up a phone, a video chat with them. They would be more than happy. I'm sure they're going to be thrilled that I suggested that for each of you. So some of you are probably wondering, will this webinar and other webinars that we do throughout the year be available for those who can't attend? So we are recording today's, and we'll record all of our future webinars and put those on the member resource page on the website. So there's a lot of great information here. If you're preparing for 2016, I know it's hard to believe that we would even begin to talk about that, but you can download the membership standards, the Better Business Bureau's Wise Giving Alliance. You can begin to start getting all of that geared up. And then also we wanted to point out to you that we do have a new process that if you have a change of address, especially when it comes to your distributions, you would want to send that over to us at member.info@Health Charities. So the form is there also for you to download and be able to get that to us. Again, if you have any application or campaign questions, you can always use Member Connection. And then the finance also is listed for you. I did want to point out that the member seal is available also on the member resource page. So this is a great opportunity for you to download, especially during CFC, but other times of the year if you want to highlight the partnership with the Federation, it is available to you on the member resources page. Also, sometimes I have had groups ask me for the combined federal campaign approved charity, and so you can go and download that as well to use during the fall. I don't see that any questions that we haven't addressed have come in, so if you do have any, please feel free to connect with us after. Send them in now. I'll stall a little bit to see if there's any that come in. But we just thank you for showing up to this first webinar, and we'll continue to listen to your feedback, gain a better understanding of how we can serve you better, and then try to implement those things as soon as possible, working with all of the teams here at Community Health Charities. So one of the questions was, how do we get our donor reports? Do we have to request them? Those will be sent out on the slide. So CFC will come in April, and then non-CFC, the first will be in June, and then a final in July. So that should come to your inbox. If you don't receive those during that time frame, definitely send an email over to finances at Health Charities to let them know that you did not receive that. You can always send an email to them as well, confirming they have the right email address on file for your organization in case that may have changed since last year. I don't show that any additional questions have come in, but we'll be here, so definitely let us know if you have anything pressing now or otherwise that we can, really hear from you. And again, we want this to be a great relationship that we can better serve you and take all the different pieces that we've learned from year one and import them into year two to make it an even more successful time together. I don't see any other questions have come in, so we'll go ahead and shut down for today. Give us a little bit of time and we'll get today's webinar posted, as well as stay tuned to your member connection update for any additional upcoming webinars. Thank you so much for your time today and look forward to talking to you soon. Take care.